So this story happening now, and we'll take you there straight away. The National Assembly passing the NHI bill with 200 votes against 125 votes.
Now, the bill will now be sent to the National Council of Provinces. Let's go to the briefing on the bill live now.
From the time of President Mandela, policy decisions taken in terms of free access to health services for pregnant women and children under the age of 6, and subsequently a policy to open up primary health care services free of charge to all users, and overall an expansion of the public health capacity in terms of infrastructure, in terms of human resources, in terms of all other equipment and capacities. But one of the downsides over this period has also been, driven by an approach of our, overall economic policy of a mixed economy. Together with that, then, making it possible for also quite a major growth of the private health industry, both at the level of financing in terms of your health insurance products, but also, and with the growth of the middle class, as the economy was growing, so a number of people who were excluded from the economy starting to have access to reasonable income, also with the growth of the public service across from the three spheres of government: local government, provincial and national, and also various growth of other various entities. So a significant growth in the people who have income, and with that opening up opportunities for medical insurance, and then of course also allowing also a growth in the private health care provision itself. Some years back, before 1994, there would have been just a handful of private health providers, especially at the level of secondary and tertiary services at the hospital level. They would largely have been mainly GPs, dentists, and those kind of services. But what that over time has done has been to create a two-tier system, which has developed its own complications in terms of the distribution of very scarce national resources, with a situation where, on the one hand, you have the public health sector continue to be the base, carrying the base load of looking after South Africans, and with significant investment, but not possibly as strong as it could have been. On the other hand, taking away some of the user fees and collection, and with the growth of the providers on the private side, becoming also quite a complicated situation where the cost of those services have also just been spiraling, and so having reached that kind of a stage now, it has been the reason why the debate about reform of the system has been an acceptance by various role players that this direction of a two-tier system with one increasingly, carrying a bigger load of your general population, but the other one consuming huge amount of resources, which, if there was a kind of sharing of those resources, could also contribute towards the vast majority of the population. That's why this debate about what kind of reform is required, and that's why we're saying that today it's indeed a very historic day in the sense that the basic legal framework for reforming of the system is now being laid. Of course, the journey is still halfway because it must still go through the National Council of Provinces, but it lays the foundation for an approach which can result in a situation where both the contribution from general fiscus collections from the revenue service, but also those contributions which many of us who have income are making into private into private insurance products, generally called medical schemes, can then be able to find a formula through which all those extra contributions can be pulled, and we can be able to use that muscle to increase the capacity. The public health system will remain, the mainstay in terms of carrying the provision of the services to the vast majority of the population, but with a fund established which can also be able to access services from the private providers at a more cost-effective, cost, will be able to expand both access. We know very well that while your public health system is overburdened with demands, many of your private hospitals, some of them are functioning at less than 50% at any given time in terms of capacity. I mentioned the other day when we were at the Presidential Health Summit that I was talking to an old colleague of mine who's a doctor who's gone into the industry of private health, who's got one or two hospitals. And we were just discussing, because I happened to be in Durban and I was at the Prince Machine Hospital, and we're looking at the kind of pressure of services at that hospital, and talking to the management there. Amongst other things, we're talking about maternity services, and I was asking, what is the number of deliveries happening at the Prince Machine Hospital? And they indicated that in a month they deliver between 1,000 and up to sometime 1,500 babies. And when I was talking to this colleague, obviously the private hospitals are not as huge as, but in the same city. And he was saying to me that in this hospital, if he delivers 60 babies in a month, that's a big, and that, especially after COVID, that is, he hardly ever even sees that. They're usually between 30 to 40 deliveries, almost one delivery a day in the entire hospital. So that's the kind of spare capacity which exists. And of course, in order to what it means then, therefore, is that they are suboptimally utilized, but to maintain them and sustain them and still make a profit, they have to find ways. And that's why you will find, again, just as an example, and he himself confirmed what, in the same city I was meeting some pediatricians, and they were complaining to me to say, you need to do something. In the private hospitals, you have a cesarean section of up to 80% of all deliveries being cesarean section. And this colleague of mine also confirmed that in his own private hospital, they do up to 70% of cesarean sections. So there are a number of factors which therefore makes it much more costly. So we believe that the passing of this bill today, as it is still going to go through the Council of Provinces, start to lay the foundation through which, if finally it can be signed into law, it will create that framework and foundation for us to be able to reform the system, so that increasingly we can go into a direction which is different from where we are going now, where you have an over-concentration of almost over 51% of the resources utilized by South Africans for health services being in the private sector for only 16% of the population. And if we could find a different, rationalization of those resources. And I must also hasten to say, what we are envisaging is that the kind of expenses which individuals who are on medical insurance have to part with, once the process can be really functional, and where we can share and rationalize those resources, people who are having income will not have to spend anything close to, hopefully, even a half of what generally those of us who have income currently are spending on medical care. We believe that, of course, these are early days, even once the full act has been passed and signed into law, its proclamation of various components of it to function. But we believe that there is already elements within other reforms and other experiences, including COVID itself, that there are a lot of experiences. Just to give you an example, just the issue of the health information systems. Currently, I was, again, when we were going to the health summit, I asked the DG and the DDGs, we're looking for just basic data from the private sector, including maternity services, children's services. And it became clear that we don't even have the clinical data. We don't have a system through which we only have public health services data. When it comes to what happens in the private hospitals, the very important clinical data which we need also for overall national planning is not there. But during the high levels of rollout of the COVID vaccination, we developed within the department the electronic vaccination data system, which was led by Dr. Chris Pierre with his team in the departmental health information systems. And that system proved to be quite reliable. At the end, we had one system. We're able, whether a person vaccinated in the public or in the private sector, on a daily basis, we're able to know where we are, and this data is still available for us. So there are a number of areas in which a lot of groundwork has already been done, but we are also conscious of the fact that there's a lot more which will need to be done. We know that some of those who opposed, including in the debate today, they argue that rather than interfere with the private health, we must just focus on the public health. And we disagree because at the end of the day, we are one country. And, we believe that while there's room for private, investment and input into various aspects of health, but the final access to health services when people need health services it can't be correct to be treated like any market commodity where you must buy. The elements within the health value chain, producing of medicines and equipment and diagnostics and so on. There are a number of areas where there is huge opportunities, but we believe that at the end, when somebody is ill and needs to be attended to, and because it also health doesn't start when you are ill, but in public health, in prevention, in promotion of health, good health, all those things need all of us to contribute towards. So in conclusion, I just want to say that we do understand why there will be some genuine South Africans who will be skeptical, and we understand that those who oppose interventions such as the NHI take advantage of some of those legitimate concerns in terms of the capacity of the state, in terms of implementing a number of projects, running a number of institutions. It's not something we can wish away. We must make sure that those things get fixed, including in the current provision of health services. It's not only the pressure, but it's also in a number of clear examples where there's been mismanagement. In some areas, in the extreme, also some elements of corruption have also been unearthed, and those must be dealt with. But we also say that within, if you look at the base load, which is the public health system again, there is also good examples. There are a number of examples of well-functioning institutions, despite the pressure under which they function, but who are managing, to the best of their ability. And we do from time to time get messages of a number of people who are very complimentary about some of the services which they receive in quite highly burdened health facilities. So we want to assure South Africans that we are conscious of all this, and we're paying very deep attention to them to make sure that the managerial and leadership risks must be addressed, and that's why within the policy itself we have said that the NHI implementation is not going to be an event. Today's passing of the bill is an event. It's in the assembly, it's passed, but actual implementation is going to be a process. And we have said over and over again that it will be in stages, with a major focus on primary healthcare and building up into broadening a number of other services to cover all South Africans. So we will definitely handle this reform process with care. Thank you very much, Foster.
Thank you, Minister, for clarifying and also elaborating the process as far as the NHI bill is concerned. So I believe.
And that was Dr. Joe Pahla, the Health Minister, announcing the passing of the NHI bill. Effectively, they finalized the legal framework, but it still has to go through the NCOP, calling today an historic day to reform the system. It's not going to be the silver bullet to fix all of our health problems, but it is a step in that direction. And he's also hoping that through the process and the implementation, some of the endemic structural issues in public health will also be sorted out.
And you'd remember there's been a lot of criticism. We even spoke about this here on the show just a few days ago about this NHI bill, and some of those in the private sector and those who are watching with keen interest, were very skeptical about the ability for the state to be able to carry this. And Dr. Joe Pahla ending off saying that he understands why some would be skeptical about this, and saying that the capacity of the state, he understands, is also under scrutiny right now, and he also then pleads with them to be able to just give this a bit more time. But whether or not this is the last we've seen of this, even outside of the NCOP process, is of course another one to watch.